All right, so today we are going to be talking about using visit and exam templates for virtual visits and COVID-19 patient care, which we're all in the middle of right now. So that is what we'll be talking about today. So as you can see, there's me and there's Sarah Joy. I am an EMR specialist at the South Calgary PCN. I'm an RN by background and a data geek by choice. And then Sarah Joy is an analyst for the AMA ACT team. So here's a little agenda, welcome and introductions. Then we'll go on to looking at some Wolf templates. Then we'll look at some virtual care tools around 1:30, and then we'll wrap up just before 2 o'clock.
Okay, thanks, Becky. So first, we just wanted to point you towards the new Emr Virtual Guides, just as a reminder that these are some really useful tools that you can use during this time. So if you go to the ACT website and then go to the Emr Supports tab here, you'll see at the very top, there are 5 different guides for each of the top 5 EMRs used in the province. So the Wolf one, if you looked at it back in April, it was updated last week. So I suggest going back into there and just taking a look again. Okay, so before we get started, we wanted to give you an important update about obtaining patient consent. So there were some clarification points that we got from our AMA privacy consultant that I wanted to share with you, just so everyone's on the same page about the different, the regulations around obtaining patient consent. So one thing to note is that patient consent is required for all virtual care tools, whether they are regulated or unregulated. So phone calls are not included in this. You do not need patient consent for phone calls because implied consent is, consent is implied, sorry. And phone calls are also likely included in the clinic's PIA. The only thing is, just to be sure, it never hurts when you're talking to a patient on the phone, just to ask while you're on the phone with them. So hopefully that makes sense. Verbal patient consent is okay during the pandemic, but in normal circumstances, written consent is required. So I think we touched on this last time. But what this is saying is that whenever possible, if you can get written consent, that is recommended. But obviously we realize that's not always possible. So verbal patient consent is also okay just during this time. It is also recommended that patient consent be obtained when patient demographics are confirmed. So there was a question last time, I think, about how often you need to get patient consent. And there's no strict guideline on this. So it's kind of up to the clinic or the physician to decide. But the recommendation is that just as you would confirm a patient's demographic every time they call or come into the clinic, use that time to also obtain patient consent and just make sure that patients continue to give their consent. So obviously use your best judgment. If a patient has 3 appointments in a row within the same week, maybe you don't need to every time, but that is the guideline currently. And then finally, patient consent must be obtained anytime virtual care services change. So that means if you're adding a virtual care tool, say you're adding maybe secure messaging, you're suddenly using email to communicate with patients, then you need to obtain patient consent once more for every patient. So does that make sense? Are there any questions? If so, put them in the chat. Feel free to unmute yourself and also ask them on video. And Becky, I'll look to you to look at the chat if there are any there. Thanks. Okay, if not, we'll move on, but feel free to email us if there are any outstanding questions as we go on, or even just put them in the chat during this webinar here. Okay, so now we're going to go into using EMR templates for virtual care and COVID-19. And so we'd like to thank Edmonton Southside and Samantha Ray, who's on the call with us today, for all of your help and work creating different templates for this work. And we of course acknowledge that there is other work going on in the province. This is just what we're aware of. So if you are one of those people that has created an EMR template for use within some of your clinics or your PCN, we would love to see those, and we would love for you to share those. Even if it's just as simple as a single drop down in an exam template or a single change in process flows. Those things are always helpful. And honestly, the simpler the better, right? We don't, complex is not always the best fix. So, so please share as you can. Keep hitting the wrong button to change slides. Here we go. Okay, so quickly, we wanted to go over just some of the smart forms that we talked about last time. So one of them is the COVID-19 initial screening tool. This is a smart form that is saved in the Wolf EMR if you're on the last update or the latest update. And this can be used by a reception staff, for example, or MOAs in that for screening patients when they call to book an appointment. And then we have the COVID-19 assessment tool smart form. So this one can be used by a provider when they are actually seeing a patient and assessing them for COVID-19. So that's just a quick recap from the last webinar. If you don't have these in your EMR for some reason, or you want to upload one that you can customize, they are on the Wolf resources page on the Collaborate website.
And I'll just chime in and remind that the smart forms look really pretty and nice, but you cannot extract data out of it. So just kind of know that that's the type of document that you're using if you're using a smart form.
Yes, great point, Becky. And actually, that's a really good segue into this next slide. So Sam Ray is an EMR consultant for the Edmonton Southside PCN, and she has been wonderful and done lots to help us prep for this webinar and even with the Emr Virtual Guides. And so we'd like to thank Sam for all of her help. And so Sam has developed some templates in Wolf that she's going to share now as a live demo. And this is because of what Becky just said. So smart forms are great, but we can't pull data out of them. So Wolf templates are an awesome way of being able to record data that you can then search using the practice search and get more data out that way. So Sam, I will pass it on to you, and hopefully you're able to share your screen from here.
All right, well, thank you very much for giving me this time to share these templates that I'd created. So I'm just gonna show you a couple of different templates first. Then I'll walk through how I built them, and then you guys, if you wish to build templates in the future or for outreach purposes for other reasons, you can follow this same sort of process as well. And then I'll also show you how we can transfer these exam templates from one clinic to another at the end here. So you guys don't have to recreate these ones that I'm going to show you. Can I just confirm everyone can hear me and see my screen okay?
Yep, yes. Sounds good.
Perfect. Sounds good. Okay, so I have a patient's chart open here. And I'm going to create a new encounter. So I'll show you the first one here. So when you open up the encounter note, what we're going to do is select the templates type, which is up here, and click on COVID check-in number 1. And then you'll see here that we have pre-defaulted sort of wording built into the template. So we're just going to click on yes. Give it a second for it to load. Perfect. All right, so this is the template. In this subjective note at the top, we just have the standard sort of establishing identity, verbal consent is given or written, and the disclaimer for the patient. And then we can also use some of the smart forms that have been created for that as well, as an easy way to kind of capture that if we haven't already done so. And then obviously you've got the objective. And then in this exam template piece in the middle, we have a number of drop downs. So in the first few drop downs, we have just some basic patient information. These are fixed lists, so you cannot actually type in anything for yourself. You actually have, well, that was a bad idea. That was a bad example. You have to select one of the options that is in the drop downs here. So this just goes through the patient information, and then we're going to look at the symptoms. So if a patient has symptoms, we'll quickly look at these few right here. So fever, cough, difficulty breathing. Obviously we can add more if we need to. And then in the next sort of section, we have a little gap here. We have the exposure risk suggestions here. And this is another good way to kind of prompt you if you're forgetting a specific item or can't quite remember everything in one split moment. So have you traveled outside of Canada in the last 12 months? Yes or no? Goes through the same thing again. And then on the right hand side here, you'll see all of the risk factors that are present. So we can, if patient doesn't have any risk factors, then obviously no, yes. And then this prompts you again to say yes or no to any one of these different risk factors. Again, my memory is terrible, so having this as a prompt would be ideal for me. Then again, you can just quickly go through and yes or no. You cannot type in any of these boxes. And like Sarah Joy and Becky just kind of suggested, these text boxes are searchable in the practice search. So the geek in me, I like to search data regardless of what it is. Sometimes if nobody else wants to know, sometimes I do just for curiosity. So this is ideal, especially when we have these fixed lists. We cannot actually, it makes it easier to pull that data instead of having those free text boxes. But obviously we do have those text boxes available as the regular SOAP note as well, either side of it. And then just along here, we have some generic sort of triggers or prompts for advice given to the patient. So maintaining self-distance. And these drop downs again fixed, but they're a little bit different. So this is the advice that I gave to this patient. I didn't require to call them immediately, just to maintain self-isolation. You guys get the picture. And then the assessment text, as I'm only in a sandbox, I wasn't able to add this specifically to the assessment piece itself. But the text box for the assessment, this is the COVID-19 diagnostic code. And then obviously you've got your plan to kind of discuss in there as well. So does anyone have any questions on this template? Seems quite straightforward.
Actually, I had not so much a question, but just, well, I guess it is kind of a question. Just wondering, so what Sam has created is a SOAP template, and I was just curious if people are aware of the difference between a SOAP template versus an exam template. And just because there is a little bit of a difference there, I guess I'll just say that Sam, if you can scroll to the top of your screen there.
Yeah.
So basically, in a SOAP template, you can add pre-fixed text to any of the boxes, as well as having the clicky click exam template thing. If you just create an exam template, all you would get would be these drop-down lists. But Sam has used a good feature in, we're going to always have that subjective text at the top there. So yeah, that's why this is a SOAP template, because it includes all of the SOAP pieces instead of just the exam template part.
Perfect. Thanks for clarifying that, Becky.
And I did have one question, Sam. So if you scroll down further, I know in one of your templates you had said that you were able to attach some template documents.
Yes.
Yeah, could you show us how that works?
Absolutely. So at the bottom of the template, you can add your labs, medications, and here you can add template documents. So these ones have been fixed into this specific SOAP template. So then you would just click on the link for the COVID-19, public health, how to care for a person with COVID-19. And I actually had it, I was going to go through this a little bit later, but I can show you guys now. So if we go to the home page, and then we're going to click on favorites and configure favorites. And then we're going to look at the template documents. Just going to click on the little arrow. So these are the ones that we currently have in the system. And then if you want to add your own, just click on add favorite, type in your name that's going to make sense to you. For example, COVID-19 assessment. And then you can copy and paste the web page information here and just check off save as template linked document. And once you've saved that, I'm not going to because I didn't create one. If you go back to the work desk and you are adding a document to a specific SOAP template, you'll go to configure and SOAP template manager. You'll find the template that you want to add those documents to. So for example, this one is the COVID check-in. So this is actually where you would build the predefined text in any of these SOAP boxes, which is super easy and straightforward. The exam template, that's the clicky piece in the middle. This is where you would select that as well. And then in the template documents, you'll see all of these new favorites that you've added. So you would just click on it and then add to linked. And then it bumps it over here. And then that particular document or website is available right from that template that you're in.
So Sam, I have a quick question.
Yes.
When you go back to the examinations field tab.
Yep.
Yeah, so that to be able to pick it from the drop-down menu, where did you create it first?
Perfect. Good question. So for creating the inside exam piece, we'll go to configure and custom exam forms. You can create a new one and then it will prompt you for a name. But in my case, I'm just going to show you. Let's go back. The COVID virtual visit type, the one that we're showing right now, and click on next. And I selected no because if it's a virtual visit, I'm not physically taking vitals, so I didn't want to have that on there. You can, for specific exam templates for generic medical things, you can click on, say, like if you wanted a cognition template, and then you would click on the FAST or the Minicog, MOCA, and then just click on the arrow button right here and it would bring it over to the selected fields. And if you just made a mistake and you want to remove one, just highlight that one and click on the left arrow there. And then, yeah, so there's a lot of different fields that you can sort of select from that are pre-built. For these ones, I actually just clicked on next and ignored all of that and created all my own. So I clicked on the yellow plus sign and the exam system. For the most part, I just used a couple of generics, so like communication or medical or action required. So you do need an exam system name. The field name is where you can manually type in what you want to make, what you want to visualize on the actual template itself. And then the field type, this is where I didn't actually click yes or no, because I believe you can still have free text in there as well. And I didn't want the free text. I wanted to limit it to yes or no. So I created my own drop downs. So in this case, patient or patient agent, I would just type in patient and then add another one and then type in the next option that I wanted. And I'm going to just delete that one so that it doesn't mess it up. And then you would click on update selected custom exam field. Then you'll see the lists all along on the side here on the right hand side. And then once you have all of these in here, if you click next, this looks kind of busy. but ultimately this is what it would look like when you're first creating one. There would be nothing in here. So you would just click on a square on the down arrow. These are all the fields that I built on that previous screen. You would just select each one in the order that you want it to appear in the template. I'm going to select one. It's already in a field spot, so it won't let you have it twice. So that's a good feature that you can, especially when there's a lot of exam items that you want to add, you lose track on where you are. So I'm going to get rid of that. So then this is what you would end up with once you have all of them in there. You just select each one and then just hit finish. And then in order to add that custom field, you would then go back to your SOAP note and the check-in. And then in the exam field, you can then select that virtual visit type that I created. So you need to create the exam field first, and then create the SOAP template so that you can add the examination field into the SOAP note. And you also need to create the template documents that you want in your favorites back on the home page first, and then come back to the SOAP manager, find your template, and then add your documents. Does that make sense to everybody? I know it's kind of a lot.
And Sarah Joy just mentioned in the chat that there are lots of great Wolf help files. If you're kind of embarking on a big template making adventure, I would recommend to look at those help files, because it'll help walk you through kind of step by step.
Yes, exactly. That's perfect. Because I was trying to talk a little slower, but I don't know if I was slow enough for everyone to make notes.
Yeah, I think your explanation was wonderful, Sam, but it's hard to learn when you're just watching too. So
right,
yeah.
Exactly.
Yeah.
So I'm just going to quickly show, I know how I'm doing on time.
Oh, you're good.
I'm good. Okay. I'll just quickly show you the second version of this. It basically has the same information, so I've just created another new encounter. And I'll open up the encounter here and click at the top here under the visit templates, and I'm going to click on COVID check-in 2. So this is all a typed in text that is built into the SOAP note, so I'm just going to hit yes. So now half my chart note is done for me. So it basically has the same information in this SOAP, in this objective. Again, just because it's at the very beginning, we do want to establish the identity, verbal consent, and disclaimer. And then I have in here the specific symptoms that are related to COVID-19. So in this case, I have just listed them all. And what you can do is just delete those that the patient does not have. Or if the patient only has one, just delete all of them and just type in the one that you do. And you can track how many days the symptoms have been started. And then again, the exposure risks as well. These are the sort of main risk factors that we're kind of focusing on, I think. So these again are just prompts to remind you of the different risk factors, and then you can just delete the ones that are not applicable. So then in the objective, again, same thing, patient risk factors that make them a higher risk for these. Again, I just typed in basically all of those drop-down menus that were down the side. In the previous template, they're basically all here. So over 65, asthma, chronic neurological, etc., etc. Just delete the ones that are not applicable. And then we do have a small exam template just in the middle with the 4 drop-downs. So again, patient or agent, sometimes we do speak to the patient agents. Consent is obtained either verbally, written, already documented on chart. Patient declined. Obviously, in that case, we would stop the visit right there. Just the type of visit. So is it a phone call, email consultation, video conference, phone audio via video conference? And then again, in the assessment, I just pre-typed in the COVID-19 diagnostic code. And then in the problem, nope, sorry, the plan, again, it's those same 4 options that were in the last template. So maintain self-isolation and call 911 if they get worse, 811 if they get worse, call 811 immediately, arrange for physician follow-up. Sorry, did I have a question? I heard a little noise.
No, I don't think so.
Nope, okay. Hearing things, excellent. So then again, you can pick which one you need and delete the ones that are not in there. And again, same thing, template documents, I have the same documents attached. And I think these documents are also attached to the smart forms. So if you prefer the smart form version, it's basically all the same information, either as a smart form or chart note. The chart notes are a little bit easier in terms of searching if that's your desire, like mine. So does anyone have any questions or concerns with the 2 different exam types or template types?
Again, not a question, but a thought, because I like sharing my thoughts.
Mm-hmm.
It's always so interesting to see all of the different ways that you can skin the cat. You know, I'm sure that every clinic kind of has its own ways of problem solving through what their individual clinic needs, but it's always interesting to see how another clinic has problem solved, because, you know, often it'll give you a little idea that you didn't have before, or, oh, I hadn't thought of using it like that before. So, yeah,
Absolutely. And it's funny you were saying that people use different options. I did actually create, it's almost like a consult letter, but it's as an encounter note, and it would be, I can't even remember. I think if we, as a physician or clinician, if you add consult letter on the side here on the physician's schedule, I think I have to create a new one. So I created a COVID-19 template here. So it's basically like a blank letter. All this information is actually not there to begin with. It would start separate. And then depending on the type of visit that you're having, if you haven't had the disclaimer yet, just double click on the disclaimer and it will pull that paragraph up. Obviously you would need consent if the disclaimer hasn't been done yet either. Type of consultation, the reason for visit. If it's COVID related, then you can click on these. If it's say for example, a chronic illness discussion, just double click on that and it will prompt you, and you can type in whatever you want in here as well. And then obviously the plan. So you can select whichever paragraph, so to speak, you want. And that way it's in the right order. Because I know with the chart notes, you are somewhat limited with the customizable piece. It's all in the middle in that exam template. Whereas some things don't belong in the subjective, but that's just the top of the note. So that's why you would do the identification and consent in the subjective, even though it's not actually subjective. So it's just another sort of option that you could do as well.
I've never seen that way. Thank you for showing.
Yeah.
Thank you so much, Sam. That's
Yeah.
really helpful to everyone. I know for myself, it's helpful to see the different ways that we can do this same kind of work. So hopefully it's helpful to people. And I do actually see that we have Dr. Wong on the call. So Dr. Wong, welcome. So Dr. Wong, actually, he joined the Edmonton Southside PCN, which is also where Sam works, back in 2014. So he's been a member for nearly 6 years now. And he's been kind enough to join us today to share some of his experiences with using the TELUS EMR virtual care tool. So Dr. Wong, if you're able to share your experience using the new virtual care tool suite, and so maybe some challenges that you might have had, solutions you might have found to those challenges, some of the benefits, maybe how patients have reacted to the use of those tools, that would be great.
Well, I find that it's usually quite well received. I don't see any patients did not like the idea. Sometimes you know, people might want, like, they're kind of not dressed up at home and in the pajamas and stuff like that, but in as far as using it as a clinical tool, basically, when we see a patient, we take a history and we listen, and then, but this kind of adds on a second tool that we can actually see other than listen. So if the patient wants to show me something physically or mentally, that this is an extra tool that we can use. So we still miss the touch part, so that we cannot, like, examine the patient, but it does add on something in addition to a voice type of history. So you got a visual history as well.
Yeah, absolutely. That's a good point. And have you used the secure, I think there's secure messaging included in there. Is that correct?
That we have been using for a long time. We have a patient portal that would tell us where we send encrypted email to patients, and as well as show them the lab reports. The limit on that on the portal is that the patient is not able to send me attached information on that type of email. They have to be, everything has to be typed, but they can attach a photo or a document. But as far as messaging, that is how we can communicate with the patient, with an encrypted email.
I think, Sergey, what you might be thinking of, it's not secure messaging within the virtual care thing, but I think if patients don't want to visually be seen for whatever reason, they can type during the virtual care visit. I believe that that's what that is. But I don't think that doesn't get put into the patient record or anything like that.
Okay, thank you. Yeah, that's good to distinguish then. And Dr. Wong, we did have a question in the chat here. So there's a question about how do patients feel about the use of technology? Do you have any issues there? So for example, patients who don't have the proper technology to be able to do a virtual visit?
All they need is a cell phone that got a camera on it. So the quality depends on the quality of the camera. And but most of the video is more than we need. The positioning of the camera and the resolution could be better in some cases, but there was a lady here that she didn't really want to do a gynecological exam with the camera. That's understandable, but otherwise, I don't think there's any there's any barrier. The older the patient, the longer it takes for you to explain how it works, but I let my staff do all the preliminary work.
Mm-hmm. Perfect. Yeah, it doesn't sound too complicated then, which is great. No
difference from what we're doing right now.
Yeah.
And just another thing as well. the actual video between the doctor and patient is not saved in the EMR. So it is just a facilitation tool between the two of you. So just so that you can assure patients that we're not taking screenshots from the video and putting it in their chart, or the video itself and putting it in their chart. It's just a facilitation for discussion.
Yeah, thanks, Becky. And we do have another question in the chat for you, Dr. Wong. So how often do you actually use this tool? So are you doing mostly phone calls, messaging through the portal, or is it, how often do you use the virtual tool?
To use this tool, it does require 10-15 minutes of preliminary work just to make sure that it works. Like even now, it takes me a while to get used to Zoom to talk to you guys. So for the patient who hadn't used it before, we do need the staff to spend 15 minutes showing them how it works, and sometimes in some patients who are not tech savvy, they sometimes takes longer and they get into problems in terms of making it work. So so unless I absolutely need it to see, if the looking at the face is not absolutely necessary, sometimes I just use the phone call. So I back to the question, I might use it 3 to 4 to 5 times a day. That's about it.
Mm-hmm. Perfect. And then we had another question. How long would you recommend booking a virtual visit for?
That's the same as how the doctor, well, you need 15 minutes of preliminary work, but that's the same as how long you want to book the patient to see in person in the office. Some doctors very fast, some doctors, chat with the patient for half an hour. So it entirely depends on your clinical style.
I think what I was wondering was, you talked about the 15-minute preparation. Is that just on your own end, just getting your own tech set up, or is that 15 minutes on the virtual call with the patient to get them figured out and set up?
Now, first you have to pre-book the appointment and tell us. I think only let the message comes up every 5 minutes. So you need at least wait 5 minutes for the message to show up on your schedule. And then and the patient has to get the email, receive the email, and then see the message, and then you have to go through the explanation of which button to push, and then you have to set up the camera so that you can actually see. And depends on the patient. Some people are, probably talk on their webcam a lot, so that's no issue. Some people never used a webcam before, and that, then you have to, especially for the elderly, you have to spend a fair bit of time. In some situation, they have to, the lady has to call his daughter to drive in from her home 15 minutes away to come help her set up. So that sometimes it takes a little bit of time.
Yeah, it does. It sounds like a lot more work than it is just to normally book patients for phone calls and in-person appointments. But I guess it's figuring out new processes, right?
Correct.
So do we have any other questions from anyone else on the call while Dr. Wong was with us?
Would you recommend this for other physicians?
Just like any so we see patients with taking the history, talking to them. looking at them and touching them. So basically, if you got an extra tool, it helps you. It helps you with your clinical diagnosis, because if you can see what the rash looks like, then it's easier to treat than just hear it on the sound, on the voice. So it depends on what the problem is. In some situations, it's certainly useful, and some people want to see your face to talk to you, but it's not absolutely necessary on all cases. A lot of times, you don't need it.
And just in terms of future, because I know this is something that is needed right now just because of the COVID pandemic, but is this something that you see yourself adopting into the long term, even after the pandemic is over?
It is possible, and for example, it's useful if, say, for example, somebody in a rural area where they have no doctors, and then they need to see a doctor. I think this is probably the next best thing. Then you can basically see the patient and take a history without the patient driving all the way from like 200 kilometers away. But then I think what actually I think might be a barrier is I do not know what the Alberta healthcare plan is for virtual visits. But all they have to say is that they won't pay for virtual visits. Then I guess it won't go, because there's a financial consideration in it.
Yeah, absolutely. And that's a good point. And that's definitely something that the AMA is advocating for, is to have that continue beyond the pandemic, right? Because we know that's necessary. And I do know that Alberta Health is looking into a provincial virtual care tool that physicians could adopt. So that might be coming out as well, but I agree with that for sure.
Yeah.
So yeah, if there are no more questions from people, I think we'll let Dr. Wong go. And so if you want to quickly, yeah. So thank you so much, Dr. Wong. Thank you for your time.
Thank you.
Yeah, and the valuable information that you provided today.
Thank you. Bye-bye.
Bye. Okay, so I'll go back a couple slides just because we skipped a few here. So while we're talking about virtual care tools, we wanted to go back to this slide here, this beautiful slide that Becky made for us. So this is virtual care options for Wolf users specifically. So we don't have, actually we do have Medio in here, which I believe is Acuro linked.
You can, the Medio that is attached to Curo is embedded within the EMR, but then there's also a separate just online version of Medio that's not integrated into the EMR that any user could use, any EMR.
Awesome, thanks Becky, that's great. So yes, we wanted to go back to this because we talked about this last time, the regulated ones, but there are some new ones. So we talked about Bright Squid Secure Mail, that hasn't changed. There is now the TELUS EMR virtual care tool. Now there are recommendations. Physicians have been able to negotiate on price for this. So we definitely recommend physicians to negotiate and not just pay whatever TELUS would like them to pay. We've heard of discounts up to 50%. So that's something maybe to share with your physicians. And right now, if people sign up before May 31st of 2020, they can get 4 months free on the software.
And that's an unlimited number of providers. Unlimited.
So I would definitely encourage your physicians, if they haven't yet, even if they're not ready to use it, to at least sign up before the end of the month. And then, like we said, there's Medio, so that online version. PurposeMed is a new one, actually, that is now regulated, not integrated, but that is another one that is secure under the Alberta PIA. And lastly, AHS Zoom. So AHS Zoom can only be accessed by physicians who have AHS access or are considered AHS physicians. And then the unregulated tools haven't changed. And all of these can be found on the AMA website, so not the act.albertadoctors.org website, the albertadoctors.org website. And if you go to their virtual care page, you can download a toolkit, which is near the bottom of the page. And in this toolkit, which is a Word document, they have a table here. And so it lists all of the virtual care tools here. And then it will tell you what different features they have in there, as well as these last columns here are really important. These will tell you whether or not it is a regulated tool. And so what you're looking for is check marks in all three columns. So looking for servers in Canada, encrypted data, as well as having an Alberta PIA submitted. And so I recommend going back to this tool quite often because it is updated regularly as things change. So yes, please go there. And this is the link to the website, but you can also just Google AMA Virtual Care and it will take you straight to the page. So any questions on virtual care tools before we move on?
Yes, just a question from Brittany. The TELUS Virtual Care, that is the one that is 4 months for free. And like I said, it's for an unlimited number of providers. So even like there's possibility for, therapists or, dietitians or any other kind of paraprofessional that you have. It's a great opportunity to have them be able to connect with their patients, with faces, in the mix during that time.
Yeah, absolutely. Thanks, Becky. So now that we've heard from Dr. Wong, we wanted to have I realize we're running short on time, but hopefully we can have a quick discussion on this. So is anyone else using the new TELUS Virtual Care Tool Suite at all? And have they found similar things to what Dr. Wong was sharing, or anything else to share in terms of maybe challenges or advantages to using it? And feel free to come off mute if you want to talk as well. We also, I forgot to mention this at the beginning, but we welcome you to come off on video if you're able to, just so it is more of a kind of, we would love to see everyone's faces and make it more of a group sharing experience. So, but only if you're comfortable, of course.
So we at the South Calgary PCN are in the works of looking into adopting TELUS Virtual Care. We're just, kind of going through the due diligence and all that kind of stuff. So that's where we are at. I can't see us using any other solution other than this one, just because it's, it's embedded in the EMR. But yeah, I've heard that there are a lot of other people who are using it. So is anybody else on the call using that tool or in the process of using that tool?
Or even if you're using things like Zoom, or if you're not using any, is there a reason, like is there apprehension behind using them around security or privacy, or just not being sure how to integrate them? Or are people just not seeing use in them, or? Yeah,
I was gonna say, it doesn't sound like it's being used from the people that are on this call. So I'm just curious why. Oh, here we go. Michelle is saying she's using AHS Zoom as the physicians that she works with are AHS.
Great. And how's Michelle, even, if it's short enough to put in the chat, how has that been successfully used? Have you run into any issues, or has it been fairly smooth?
Hi. So yeah, it has been actually fairly smooth. It was easy to set up for the physicians, and we just did process step instructions. It's been fairly simple for the patients so far. They're happy with it. And so that's what we've been using. We did inquire into the TELUS EMR one as well for the care virtual care tool, but we have not heard back from them yet. So we're just kind of waiting for them to respond to us. So.
Yeah, thanks, Michelle. I've heard that too, that sometimes the wait can be quite long.
Yeah, we've been waiting a couple of weeks already. So.
Yeah.
Do you, I think that as soon as you have one of their representatives kind of connected to your clinic, I think that it goes more quickly. So like we had initially kind of put our name in there, be like, yeah, you know, we want this, and we were on a wait list. But then when I reached back out again, it didn't seem like there was a big wait list anymore. And instead I had to kind of take the next step of connecting with a representative and getting a quote started and all that kind of stuff. And so I think that might be.
Yeah, and that's the next step too. We're going to just connect with them again and try to, because of course you want to get some quotes and things in before the end of the month.
Yeah. Yeah.
Yeah.
So how are you finding that works then with it not being connected to the EMR?
Well, there is some templates available or directions that we've provided. Of course, the physicians then they have to also have Zoom open and then be in the EMR too, which is difficult. So they have to have that open, be typing into their SOAP notes. And so that is challenging. That's why we're also looking into the virtual care tool through the EMR, because that's only one screen that they have to have open. Otherwise, they kind of have to take notes on paper or transfer it to the EMR, especially if they're phoning from their mobile, as opposed to the computer.
Right.
So
Yeah.
that's the biggest challenge is having two screens, trying to be open to type notes as well as do the Zoom call. So that's been the only challenge so far.
Awesome. Thank you so much for your comments, Michelle.
Anyone else out there? I know we're running short on time, but yeah, if anyone else has anything to share, any other tools they're using, or if they're even like Michelle having trouble getting the EMR virtual care tools set up.
I guess I have a question for Michelle. Just on going back to what Becky was asking Dr. Wong earlier, because obviously Zoom does involve a bit more technology from the physician and the patient side, how long would you then book those Zoom appointments with the patient?
It's very dependent, like as he said, on the physician, because most of our, we have some physicians that like to spend, as he said, half an hour or more chatting, and then there's others who like to get, right to the point. But again, we do the similar process where the staff explains to the patient prior to, and then has the physician connect. And usually it's about 10 minutes or so, and then the physician can enter the patient through the waiting room. So we have like a little waiting room, and then the physician, once the patient has been explained everything to, then they can just admit the patient to the waiting room or from the waiting room. So it's not been, so far we haven't had much of a challenge with that.
Yeah.
And it's gone well, but about 10 minutes prior to is what we've been doing.
Yeah.
And each appointment, approximately for the physicians, we have a max of 45 minutes that we would book, that the Zoom allows us to book, but usually we book, 30 minutes.
Awesome.
Perfect. Thank you so much, Michelle.
No problem.
If anyone else has anything to share, feel free. We'll show our email address at the end here. And yeah, we have Brittany who has to run. So thanks, Brittany, for joining us. And we'll close off here. So again, actually, Becky, I'll let you take over if you want here.
Sure. So basically, as we always say at the end of these, we want this user group to be helpful for you guys. And so I think with the if anybody has any quick things that we can kind of mention in 2 minutes that you would really, really like to talk about. Otherwise, we also do have the discussion board as well that we can use to contact each other between meetings. But is there any burning, burning topic that you just wish that this user group would tackle?
Yeah, and we do, I know we're running out short on time, but we do save the chat. So even if you just put it in there and we don't address it today, we'll take a look at it after the webinar.
All right. So yeah, with it being so short on time, I think it's best to direct people to the discussion board. Now, I'm not sure how many of you are on the discussion board, but no, Sarah Joy, is there like a document or something that we can send to people if they're wanting to join the discussion board, or is there a link to?
Yeah, so the discussion board, so if you go to the Emr Supports page on the website, hopefully, I don't know if you can see my screen, the internet.
Yeah.
Yeah, oh, perfect.
Oh, no, sorry, we can't see the internet that's opened up now.
Here, let me just try here, a new share. Okay, let's try that again. So hopefully now you can see it.
Yes.
Perfect.
It's open up.
So yes, if you go to Emr Supports here, and then you'll see right here, if you sign up, either if you don't have access to the Collaborate page, then sign up for it. If you do, you can click on the second link here, so Emr Collaborate Network webpage. You'll have to sign in, and unfortunately, I'm not signed in, but let me see if I can quickly do so. Okay, so if we do that whole step again, Emr Supports, and then go to the Collaborate Network page. So this is the new page. Hopefully it's easier to navigate. If you go to Wolf, the Wolf page here, you'll see this discussion board here. If you're not subscribed to it, click on get a notification into your inbox for the Wolf discussion board. You can sign up through there, and then anytime someone posts something on here, you'll get an email notification. And you can actually, when you're in the screen, update what kind of notifications you get. So you can, if you don't want notifications about everything, you can select what you want. So you can even just get a weekly summary if you'd like.
So yeah, we haven't had a whole lot of activity on the discussion board, but we would really like to, because we want to be able to respond to what you guys are needing us to supply for you, and or just sharing your experiences with fellow Wolf users.
Yes, absolutely. The more sharing, the better.
So the next webinar is going to be a general EMR network webinar. It won't be Wolf specific. Every 4 months, I think, or 3 or 4 months, we do a general one instead of a Wolf one. So is that a working title then, Sarah Joy?
So I believe that will be what will be discussed.
Okay.
I think we'll know for sure May 22nd is our next co-design team meeting, but that's what we're planning on talking about. So you'll get some updates on, I think there's a new secure messaging tool coming out. You'll get updates on that. We'll talk about communication with patients and PCNs communicating with clinics, different EMR workflows. So it should be a really good webinar.
And then July 8th is when we have our next Wolf specific webinar. So just like this one, and we would love a topic. We would love people to let us know what you want us to present on. So you can either email, let me just see. I guess there we go. If you go to the next slide, Sarah Joy, then that has the contact. That's the email address down there that will go to both Sarah Joy and I. So either one of us that is available to answer, we will. So yes, please feel free to email us and let us know what topics you would like for next time. Or else we'll just make something up and you'll have to just hear about it. We'd much rather have your input in there.
And thank you, everyone. Yes, thanks for joining. Thanks for all of your input. And yeah, like Becky said, share topics with us and we'll gladly talk about them next time.